I want to say something about peri-implantitis.
Okay.
We treat peri-implantitis as a disease.
Mm-hmm.
It is not a disease. A disease is of natural structures. This is a man-made disease, if you like, because it's a metal screw that's gone into the bone, coming through the epithelial barrier. Mm-hmm. We have to change the way we look at this and no longer treat it like a disease and treat it as a complication of treatment. Mm-hmm. And then the focus will turn back on the practitioners to manage this.
It's absolutely right.
So that's the first thing.
No, I mean, I think it's so important to say that, because like, obviously there's a certain percentage that we can say maybe has local conditions, maybe like it's an immune system problem, maybe it's a medical history of the patient, but like in a large extent.
You put an implant into a diabetic patient, uncontrolled diabetes, or you put an implant into a patient with uncontrolled periodontitis, you don't follow them up. You have made the decision to do that.
Right.
You're in the driving seat. It is still a man-made disease, right?
Yeah. The circle is larger.
Yes.
It's site-specific, because when we, and I will show that in the lecture, you see when you analyze the prevalence of peri-implantitis per patient or per implant, it's much higher per patient. And that means you can have 6 implants and one of them is diseased, you could say. That means that shows it's not actually the general condition of the patient, it's the local factor that turn one implant into an infected one. And that's very simple. And it's true. I think that the majority of these complications are man-made, yes.
Yeah, I fully agree.
So then, let's say man-made, that means basically like we are causing the complication partially.
And prosthetic
and is
errors.
So we have surgery, we have restorative, and of course we have lab work.
Lab work, yep.
So where do you think it's evenly spread out, or like, do you see like more promise with one area of discipline?
I think it's the surgical is probably the main one, compounded by poor restorative design, and often the restorative management and the design of the prosthesis is abrogated to the laboratory to do.
Mm-hmm,
And guess what most lab technicians do today? They never see a patient. Everything's done on computers. So they produce these wonderful 3D designs, and then they get milled and are completely uncleanable when you put them into the patient's mouth.